Nursing tambagi chang yamna wangna urabasu India nattana Malem nurse ki awatpa yamna leiri haina RIMS director Dr. Guru Aribam Sunilkumar Sharma nungnang phongdorakli. Trend Nurses Association of India TNAI amade Student Nurses Association of India SNA Manipur State Branch na punyo sindunanga si RIMS ki Jubilee holder Our Nurses Our Future the Economic Power of Care haivatim da pangthokiba ahanba TNAI gi annual conference ta wangang laduna wafamasi phongdokibani. Thorungi manung chana ahanba TNAI Lifetime Achievement Award Koirom Bimola amadi Laikhedraba Laisram Ibohol the Piduna Ikaikomna Botpa Galunina Souvenir Amasupongke. Mahagi Warolda RIMS ke Director Dr. Guru Aribam Sunilkumar Sharma hai member listing ahum dairaba chai yankai suraba TNAI gumba association ama laibasi nursing oina di yamna chawthuk chaningai ni kunai asida nursing lawriba thodang asi COVID-19 ki matamda miyamna khangnarabani Manipur da nursing tambagi masing asi yamna urabasu hospital singda nurse awatpa dumak leiri India gi oina listing ani kungamari fawbada nurse masing million Mari dasmik ahum yohonana ba pandam thamlibani WHO gi oina lisingani kuntra fawbada nurse masing asi billion mapan yohonana ba pandam thamli nursing nasu analayang lamasi hena faganana ba hona baga loinana kathok paga loinana thabak tawbiyo miyoibagi seba tawba sina khwaidagi athoibani haike
Nurses, we all know, are the major healthcare workforce. The role of nurses in healthcare delivery is immense, is not less than a doctor. Nurses play a critical and very important role in health promotion, disease prevention and delivery of primary and community care. Equally important is services provided in emergency settings and including a pandemic or epidemic like COVID-19. So that we all know the role of the nurses in our society is indispensable. WHO norm is about three nurses per 1,000 patients, where the whole country, India is having 1.7. India needs about 4.3 million nurses by 2024 to meet the WHO norms of 3 per 1,000 patients.